Several African countries on Sunday closed borders, cancelled flights and imposed strict entry and quarantine requirements to contain the spread of the COVID-19 coronavirus, which is a foothold now in 26 nations on the continent as cases keep on rising. Our correspondent Coletta Wanjohi has been monitoring the situation for us from Ethiopia. Coletta, thanks so much indeed for joining us. Tell us what global picture is being painted at the moment across the continent with this virus.
Well, from the perspective of the African Centers for Disease Control, which is based here, the headquarters is here at the African Union, the continent has cases that are increasing, but the Africa CDC says the increase is a bit minimal, especially in most countries. But what it is confident about is that it had already started preparing different member states to be able to test and to be able to diagnose and get test kits for these COVID-19. So it is hopeful that the African member states will continue being highly, in terms of surveillance and in terms of testing, it will be able to combat this. And also from the continental perspective, the Africa CDC has put up an emergency team of medical practitioners, over 40, who are stationed at the Addis Ababa headquarters here, ready to be deployed to any country within the continent that will need any medical assistance or any expertise of any kind. So it is true from the Africa CDC perspective that the numbers are increasing, a bit minimal, but they say with great surveillance, then the numbers can be combated.
All right. What other measures are being suggested by the CDC? I know that up until now, it's really been about preparation, but 26 countries now, are they stepping up activity, and what kind of things are we likely to see going forward?
Well, what we are seeing now is the Africa CDC calling on individual member states to do a lot of surveillance, to do a lot of preventive measures at country level. And it is advising and liaising with the different ministries of health and the centers for disease controls in different countries, as well as the laboratory diagnosis testing centers in different countries, and advising them and encouraging them on what to do in order to really combat the cases and test the cases in good time. We are also seeing the Africa CDC asking the member states to try and get enough resources in terms of funding, because it says at the level of the Africa CDC they do not have enough funds to even run these operations with member states. So it is asking individual member states to try and solicit for funds within its national budgets and within its own friends and philanthropists to be able to streamline their health systems and be able to test as well as prevent any further spread.
And I would imagine communication between states is something that they're trying to coordinate as people move around the continent between borders.
Exactly. So what the Africa CDC does is every day in the morning it has its what it calls an emergency meeting, where it has all the experts that meet and they discuss the status of the continent as far as COVID-19 cases is concerned. And apart from that, they also liaise with different ministries of health by speaking to them through different means and ensuring that they are on top of efforts of combating COVID-19 cases. But we're also seeing the Africa CDC director, his acting director, and other professionals going to different member states. For instance, last week, the CDC high-level officials were in South Africa to liaise directly with the Ministry of Health and the related institutions to ensure that everything is okay. And apart from that, we are seeing the Africa CDC sending regular messages and meeting with the ambassadors at different level here at the African Union, hoping that they will relay the messages to their member states.
Have they communicated any concerns that there may be some countries that just don't know that they have coronavirus in their borders?
Exactly. I mean, if you speak to the Africa CDC, director and the other officials there, they say because the coronavirus is something that is new, something that has to show symptoms before it is really diagnosed and comes out, then there is a high possibility that some countries have it and they do not know. And that's why they are saying surveillance needs to be stepped up, especially at entry points, road, air, people using air transport, using road transport by water and all that. So they're asking if this surveillance can can be streamlined, then it will be easy probably to catch cases, especially using the temperature. So, and they're saying that the advantage is at least 43 countries can now test for COVID-19, and test kits are available. They're trying to solicit for more from different donors and all that. So surveillance is the key. They're saying surveillance is the key, and ensuring that messages are given to citizens at all levels to ensure that they have the preventive measures, but at the same time report any cases through different channels that are put by member states.
All right, Coletta, that's where we'll leave it for the time being. Thanks so much indeed for that update. That's our correspondent in Ethiopia, Coletta Wanjohi, giving us the latest news coming out, of course, from the Africa Center for Diseases Control, the Africa CDC, that's managing the coronavirus outbreak on the continent. We're up to 26 countries now. Still a little, when compared to the rest of the world, we're still quite far behind in terms of the outbreak, but care still needs to be taken as preventative measures continue to be put on the ground with various countries.